And we showed you the first part of Kwame Boateng's documentary titled Withered Skins, focusing on leprosy, its impact across the whole country. We do have the National Program Manager for Leprosy joining us on stream, and Dr. Benedict Kwao is the man. Dr. Kwao, good morning to you.
Good morning.
Great.
To you and your listeners.
Great. Great. And indeed, we saw the impact that leprosy has on people. How widespread is it?
Yes.
I mean, what's the data?
Okay, so I would like to start by saying that Ghana has eliminated leprosy as a public health problem. And that means that at some point, the prevalence dropped below a certain threshold, that is 1 per 10,000. And it has continued to go down, and now it's around 0.1 per 10,000. So we still have attained that elimination as a public health threshold, but it doesn't mean 0 cases. And we continue to record cases all over the country, in all the regions, actually. So it is quite wide. I wouldn't say widespread, it's everywhere, but the case numbers are a little low.
Okay. 0.1,
yes.
all those things. What does it mean? How many?
1 per 10,000.
1 per 10.
It means that in 0.1 per 10,000 means that in every 100,000 people in Ghana, you would find 1 case of leprosy. And the challenge with that is that 1 case of leprosy, if we don't find that case early, is going to develop disability, which we cannot cure, which would stay with that person for the rest of their life. So for us as a program, Ghana Health Service, our efforts are aimed at trying to find cases early so that we can prevent that disability, make sure we give them treatment so that they are cured. And then whilst we have found them early, make sure that they don't develop disability.
Now, why is it that in the peculiar case of the victims or the patients who Seth Kwame Boateng interviewed, even though they consistently had gone to medical institutions or health institutions, it was not detected early?
Okay, it's a number of things. Usually, when people have skin conditions, we have realized that their first point of call is not the health facility, and so there's a bit about the health-seeking behavior of. And so someone may buy something on a bus, go to a community pharmacy, even go to a prayer camp before coming to a health facility. Then there's the other leg, which is when they come to the facility, whether the person seeing them is able to accurately diagnose the condition. The problem we have realized is that when people think about leprosy, they are thinking about the clawing, the disability. But leprosy starts as a skin rash, a light patch or a reddish patch. You know, it may be confused for a fungal skin infection. And so because people are not always aware of the disease, they may not diagnose it. That is one of the challenges with reducing the prevalence of leprosy. We have reduced the prevalence so much that there is a high chance that a healthcare worker you see has never seen leprosy before. So we have to find a way of always making sure that the healthcare workers think about leprosy and then they are able to diagnose. If we're able to fix the health-seeking behavior and also fix that diagnostic delay, then we will be able to find cases early before disability.
I'm sure we'll have another conversation based on what we find and as we move on. Now, in 2 minutes, because as we're wrapping up.
Yes, sure.
I'm
always available. Yes.
How is the absence of the knowledge, because maybe medical practitioners may
yes.
have not encountered it, creating a problem for you as a directorate or a program?
Well, we continue to get cases who have disability at diagnosis, which tells us that we are not yet at the place where we are diagnosing cases early enough. That is the biggest thing for us. We have attempted and we are training more people, but it takes a lot of resources to train people, go around all the country and make sure that people can have that capacity to diagnose. So it is a challenge. I mean, because we have eliminated the disease as a public health problem, on the global health arena, you don't get that much resources devoted to leprosy. And yes, you have some resources which you try and use, but it's like a little drop in a big ocean, you know. And you cannot fault the global health arena too, because there are bigger diseases. But then we also have to look at the fact that with this disease, for one patient, it can be a whole lot of distress and despair for the rest of their lives.
Well, thank you very much. Dr. Benedict Kwao, this is not the last time, definitely, because we have part 2 and part 3, we'll come back to you on this subject. He is the National Program Manager for Leprosy, and he did indicate Ghana has eliminated leprosy as a public health problem or ailment. As a result of that, we now have just the ratio of 0.1% of the population within 10,000 getting infected. So you just have to do the extrapolations for 30 million estimated population of Ghana, and you get to know how much that is. So that approximately will give you the figures. But look, we have to do showbiz as we wrap up the conversations right here on the AM show, and Kadi is ready.